Dr. Gowhar Ahmad, Senior Consultant Ophthalmologist, Florence Hospital, and you have already introduced my profile that I'm a fellowship in pediatric ophthalmology, ocular neuro-ophthalmology, and have got more than 45 years experience editor-in-chief. Today, my talk is on the scenario of the Gowhar syndrome and a rare case of Gowhar syndrome, which I have seen in a 3 years old patient. The picture which you have seen is the hospital where I work. It's a Florence Hospital multi-specialty center, and here I work since last about 10, 11 years, and over a period about 10 or 11 years, I have seen about 10 or 12 cases of Gowhar syndrome. Can you just move the slide?
Yes, next slide, please.
You can see that?
Yes.
So this is, I think this is a picture of a houseboat.
No, sir.
What is that? But I'm
Yes,
not seeing.
yes. It is your picture of houseboat with welcome note on
This
it.
is this is basically Kashmir is a very beautiful place in the world, and compared to the Switzerland and this houseboat, usually is a 5 star stuff which is usually in the Dal Lake, and the tourists come here and stay and enjoy the beauty. Now the other slide, please. Now I will go to the scenario of the Gowhar syndrome. Gowhar syndrome. The credit of this Gowhar syndrome goes to an Austrian ophthalmologist who was the first in
Next.
the year 1850 by the name of Morris Gowhar, who put forward this entity of a syndrome complex, which was characterized by, next slide please, limb dermoid congenital with associated presence of a preauricular skin tag or appendage. Next slide please. Sometimes the presence of skin and ophthalmos, coloboma of upper eyelid, iris, retina, astigmatism, microphthalmos, and Biddeford syndrome may be also seen, but this is very, very rare. Can you?
Next slide, please.
Next slide, please. Now, Gowhar syndrome is usually termed as an ocular auricular vertebral syndrome or a craniofacial syndrome, which involves the head, face, ear, nose, soft blood mandible, manifesting in the form of a high-arched palate, asymmetry facial. Here, look, please. Next slide, please. 80 to 85% cases of the Gowhar syndrome are normal from the visual, mental faculty, intelligence, and intelligence point of view. It's only in about 50 to 20% cases, next slide please, you get an additional congenital anomalies, which are usually seen in the form of defects in the kidney, double ureter hydronephrosis, defects in spine, limbs, congenital heart, underlying orbital involvement, dental anomalies, hearing defect, impaired memory, intelligence, and mental faculty, self-nerve involvement, and Down's reduction syndrome, and unilateral aplasia of trigeminal nerves, which is called as trigeminal anesthesia. Next slide, please. Now we have to work up these cases to get up these very rare anomalies by doing X-ray ultrasound abdomen to look for the double ureter hydronephrosis, and for congenital heart echocardiography, for spine limbs deformities X-rays, MRI orbits for underlying orbital involvement, and dental anomalies, dental checkup, hearing impairment, audiometry, EEG, and so on and so forth. Now, next slide, please. Congenital limbal dermoids usually are unilateral. However, they can be bilateral, very rare. Infotemporal site is the commonest. The prevalence 70%. Prevalence is about 1 in 10,000, 1 in 50,000. They are usually confined to the conjunctiva, or might be may involve the entire cornea, may be only confined to conjunctiva. They are graded as grade 1, grade 2, grade 3. Grade 1 involving the epithelium, grade 2 descendant, grade 3 the whole of the intersegment. Now, I happen to see in about 10-year period cases of Gowhar syndrome, which usually had only the grade 1 lymphodermide and did not have any other associated congenital anomalies. So 3 years old child was seen by me in my clinic about 5, 7 years back, where the parents have complained of a congenital limbal dermide on the infotemporal side. It did not involve the visual axis. There are no other associated congenital conditions like which I have already enumerated, like congenital heart, double ureter, hydronephrosis, and the defects in the this spine, limbs, or dental anomalies, all those things. So if you have a congenital limbal dermide grade 1, not involving visual axis, and no other associated anomalies, it only needs parental counseling and observations. Next slide, please. And however, if the limbal dermide involves the pupillar area to threaten the vision, then the modality of the treatment is the surgery, which is both visual as well as cosmetic. And the modalities of the treatment are lemur keratoplasty, autograft, stem cell graft, amniotic graft, and the latest is the smile lenticule and tattooing and fibrin glue, that you excise the dermide and tattoo it to restore its coloration, take a corneal lenticule, put it in the situ, and held in position by fibrin glue. However, in this entity, as we do not put any stitches post-operative pain, and the astigmatism is less. Next slide, please. We have got about golden heart storm support groups. 17 families of golden heart storm are seen in Greece. Mittal et al. In the Journal of Ophthalmology in 1968 reported 3 cases of optic nerve drusis associated with golden heart syndrome. In nutshell, golden heart syndrome is a rare congenital anomaly which is we already enumerated, attributed to Morris Goldenhor, an Austrian ophthalmologist who produced this syndrome complex characterized by the congenital limbal dermide with associated presence of periodical skin tag appendage. 80 to 85% cases are normal from the visual, mental faculty point of view, intelligence point of view. Only 50 to 20% of cases have got additional congenital anomalies, which I have already enumerated, which are believed to be due to the incomplete development of the first and second branchial arch due to defect in the genes not inherited, autosomal, or it may be because of gestational maternal diabetes mellitus, or it may be because of the intentional or unintentional intake of thalidomide, cocaine, antibiotics, or it may be because of the exposure to toxoplasmosis or cytomegalovirus inclusion virus, herpes zoster. One word about this Goldhar Strom, an Austrian ophthalmologist. Austrian ophthalmologists are one of the best in the world, and the other Austrian ophthalmologists, which one should know, are Putscher retinopathy. Again, Putscher retinopathy is a Putscher was also an Austrian ophthalmologist who produces entity, and that is traumatic retinal angiopathy, very serious, which occurs after acute pancreatitis, pancreatic tumors, carotid disease, or the 80%. It also occurs after head, abdominal, thoracic injuries because of the intracranial pressure, which increases, intra-abdominal pressure, which increases because of these injuries, or it may also occur after fat, air, or amniotic membrane, amniotic fluid embolism due to fracture of the long bones, especially the femur. So over the past, from 2013 to till date, I have seen 10 cases of the case, and luckily all these cases of Goldhar syndrome had got no other associated congenital anomalies. They were in the group of about 80 to 5%. Grade 1 limbal dermide, not involving the visual axis, needs only parental causal. But however, when you see a case of Goldhar syndrome, you have to look for the other entities, other associated anomalies which may be there by doing these investigations, which I have already told you, that you have to do ultrasound to exclude the defects of the kidney, spine, limbs, X-ray, MRI, underlying orbital involvement exclusion, dental checkup, audiometry for hearing impairment, and EEG. That's all. Thank you very much for your patient listening. If anybody has any other query or questions, he can just communicate to me.